Hi everyone. Today I'm going to talk about one of the most essential core values in nursing practice, patient-centeredness or patient-centered care. Patient-centered care is at the very heart of what we do as nurses. According to the Institute of Medicine 2001, patient-centered care means providing care that is respectful of the person and responsive to each patient's preference, needs, and values, and making sure that those values guide every clinical decision. In other words, it's about treating the whole person, not just their medical condition. This value reminds us that each patient brings their own story, culture, beliefs, and experience into the healthcare setting. No two patients are exactly alike. When we take the time to understand what truly matters to them, we can create care plans that are not only medically appropriate, but personally meaningful. For example, let's say I'm taking care of an older adult recovering from surgery. A traditional care plan might focus on only pain control and mobility goals. But if I take a patient-centered approach, I'll also ask what's important to that patient. Maybe they're anxious to be well enough to attend a grandchild's graduation, or to garden again in the spring. By aligning our care plan goals with their personal motivations, we can increase their engagement and improve outcomes. Research shows that when patients are active participants in their care, outcome improves across the board. Epstein and Street 2011 found that patient-centered communication leads to greater treatment adherence, faster recovery, and higher satisfaction. Patients also are less likely to experience anxiety or confusion because they understand what's happening and feel more in control of their care. In my own clinical experience, I've seen this value in action many times. One example that stands out was a patient who was newly diagnosed with diabetes. She felt extremely overwhelmed by all the dietary changes she was told to make. Instead of lecturing her, I asked her about what her favorite foods were and what meals she felt she could realistically adjust. Together we came up with small, manageable changes she could start with. Over time, she became more confident and started making healthier choices of her own. This moment taught me that education is most effective when it is personalized and the patient is involved. Patient-centered care also ties directly to our professional ethics as nurses. The American Nurses Association Code of Ethics for Nurses 2015 emphasizes that respect for human dignity and individual choice is centered to nursing practice. This means we advocate for patient honor, their right to make informed decisions, support their physical, emotional, and spiritual well-being. Incorporating patient-centered care into daily nursing practice also strengthens our relationships with patients and families. It builds trust, encourages open communication, and creates a sense of partnership. Instead of patients feeling like the passive recipient of their care, they become empowered members of their own healthcare team. Ultimately, patient-centered care reminds us that we become nurses in the first place to care for the people, not just their illness. It challenges us to see beyond the chart and diagnosis and recognize the individual sitting in front of us. When we listen with empathy, involve patients in decisions, and respect their values, we uphold the very essence of nursing. Thank you for listening.